Next, third type of ADR is type C. Okay, C stands for chronic effects. Okay, or continuous use. Okay, so type whatever the adverse reaction associated with type C. Okay, when you call it a type C means these are mainly resulting from chronic or continuous usage. Okay, example. So they're mainly because of the accumulations. Okay, they mainly resulting from the accumulation of drug in your body. Okay, so example, NSAIDs, non-steroidal anti-inflammatory drugs, okay, causes renal failure. Renal failure is not associated with immediate effect; it is associated with continuous usage. Next, glucocorticoids on prolonged usage generally cause osteoporosis. Again, it is type C adverse effects. Next, antipsychotic drugs. So antipsychotic drugs generally cause tardive dyskinesia. Okay, so parkinsonism like symptoms. Okay, tardive dyskinesia, parkinsonism like symptoms only after continuous uses. This is nothing but type C. Okay, next, coming to types D. Okay, so type D adverse effects, so mainly resulting delayed in actions. Okay, delayed effects. Okay, so generally these are this type of adverse drug reaction generally seen only after delay in occurrence. Okay, generally may not be seen in immediately, so they mainly resulting from delayed effects in patients years after treatment generally occurs. Okay, so it may occur after prolonged treatment, or maybe even if you stop the drug treatment, the drug effect may occur even after some years or some months. Okay, this is nothing but delayed effects. Okay, so whatever the ADR resulting comes called as a type D, these are the effect. These occurs in the patient, okay, seen after years of the treatment. This is called as a delayed effect, delayed in occurrence. Okay, so example, majority carcinogenic effect and teratogenic effect comes under type B. Carcinogenic effects and teratogenic effects comes under type B. Example, okay, so thalidomide. Okay, you may know thalidomide strategy. Okay, so when pregnant women use thalidomide, it results into abnormalities. Okay, phocomelia in the newborn babies. Only after delivery you may know that. Okay, that is next. Phenytoin, it is also called a teratogenic effect in the form of fetal Hedentine syndrome. Okay, fetal Hedentine syndrome. Tetracyclines, they cause teeth malformation, discoloration of teeth. Okay, next, aspirin. Okay, NSAIDs, aspirin, it cause early closure of ductus arteriosus in the fetus. Okay, early closure of ductus arteriosus, okay, in newborns. Okay, premature closure of ductus arteriosus, they cause pulmonary hypertension in the newborns. Okay, if mother use aspirin, they cause a teratogenic effect in the form of closure of ductus arteriosus in the fetus. Okay, like so and so. Okay, so many examples comes under here. Okay, right. So even, okay, if the women use excessive corticosteroids, sorry, not corticosteroids, okay, steroidal hormones, okay, estrogen, progesterone, okay, it causes cancers, ovarian cancers in the so in the daughters. Okay, in the daughters of the mother. Okay, right. So this is about the type D adverse drug reactions. So next, type E. Okay, so type E adverse drug reactions, okay, they are resulting from end of the treatment. Okay, so mainly they're mainly end of the treatment, so generally occurs after sudden discontinuation of the drug treatment. So type E ADR mainly resulting from sudden stoppage of the drug treatment. Okay, so whatever the effects we may seen, okay, in type E, they're mainly similar in clinical condition where you are using for drug. Okay, it is mostly result in worsening of the clinical condition for which the drug was being used. Okay, so this is type E adverse effect. For example, okay, generally phenytoin used for the treatment of seizures. Okay, phenytoin used for the treatment of seizure because it's anti-epileptic drug. Sudden stopping of withdrawal of the phenytoin, stoppage of phenytoin, it will cause seizures. Okay, right. So the result of the type B adverse mainly mainly the effects, reverse of the drug effects. Okay, right. Phenytoin generally cause seizures. Okay, next, barbiturates generally cause, they are used for treatment of insomnia, okay, or seizures. So sudden withdrawal of the barbiturates cause anxiety, okay, hallucinations or seizures. Okay, so barbiturates generally used as an antiepileptic. So if sudden stoppage cause seizures, maybe anxiety. Okay, next is beta blockers. Okay, beta blocker generally used for the treatment of hypertension mainly works by blocking of beta receptors, beta 1 receptors. Okay, so sudden stoppage of the beta blockers, it results into getting of angina pectoris. Suppose you are using beta blockers for the treatment of angina pectoris, okay, or myocardial infarction. Sudden stoppage, you may get angina and myocardial infarction. This is called as a type B adverse drug reactions. Okay, these are the definitions and types of ADR. Okay, A, B, C, D, and E. Okay, so next, coming to next topic is, okay, objectives of ADR monitoring. Why you need to monitor the ADR? Okay, next topic is detection and reporting. Okay, in this video I will tell you what are the how you are going to report the ADR. Okay, so reporting of ADR. Okay, reporting of ADR. So before reporting ADR, so what is the objectives of ADR monitoring? Why you need to carefully watch the occurrence of the any noxious or unintended effect associated with the drug molecules. Okay, in order to improve the safety of the drug treatment, in order to improve the safety of the, that is only our main motto. Improve the not only efficacy and also improve the safety of the therapy. Okay, so main objectives, what is the main first objective is, okay, to detect the nature and frequency of ADR. Okay, so by monitoring you may know that, so what is the nature of the ADR, so how is going to be exhibited. Okay, in the form of serious, or maybe the mild, or maybe so maybe simple, mild, or serious. So what are the characteristics of the ADR and frequency. Okay, so frequency of ADR may be resulting from immediately, or maybe after some times, or maybe so like that. Okay, so in order to detect the nature and frequency of ADR, okay. Next is providing updated drug safety information. Okay, so provide updated drug safety information. You may continuously monitor the ADR. So whenever the monitor ADR, you may get new ADR. It results into the updates, so information, so that you can provide the updated information to the healthcare personnel. Okay, so providing updated drug information, you need to continuously monitor the ADR. Okay, so next, updation of the packaging inside. Okay, you may seen that every pharmaceutical product, it causes one package inside. It consists of it gives the information about, total information about the drug. It may include kinetics, dynamic, and as well as the side effects. Okay, so that you may notice new ADR. Okay, you may observe new ADR only whenever you monitor the ADR of the drugs. Okay, then only it is possible to include the updation of the package insert. Okay, package, so that you may dissemination of the information to the in the market. Okay, so next is initiation of further studies for educations. Okay, further studies, so based upon the ADR, so you may you may find out the, so what are the precautions you may take, or maybe how to you may find new indications. So what are the underlying mechanisms for the ADR you may get. Okay, so that monitoring of ADR is also resulting in initiation of further studies for education point of view. Okay, by knowing ADR, you may know that, okay, especially benefit of, especially long term prevention of relapse. So suppose for example you are going to be used for a particular drug for the long term uses for a prevention of relapse, or maybe new uses for study of new indications, or over usages. Okay, so next, possible mechanism of underlying ADR, you may resulting from by knowing the ADR. Okay, initiation of further studies based upon the ADR, you may study further, so that is will be useful for the following conditions. Okay, next, to identify the risk factor that may predispose, induce, or influence the development, okay, severity, incidence of ADR reaction in the population complex. So by knowing ADR, by monitoring continuously ADR, you may predict the some risk factors which causes ADR. Okay, maybe other drug may cause enhance the ADR of the drug. Okay, maybe because of genetic problems, may ADR may exhibited. So maybe some diets will encourage the ADR. Okay, so maybe culture have anything. Okay, maybe dose, maybe bioavailability, anything. Okay, by knowing ADR, okay, by continuously monitor the ADR, you may know the what are the identifiable risk factors, okay, which causes ADR. Okay, so this is nothing but objectives of ADR monitoring. So all together will improve the safety of the drug treatment. Okay, so this is nothing but ADR. So how to report the ADR? So you need to report the ADR, okay, through ADR reporting form. Okay, by filling ADR reporting form. Okay, so this ADR reporting form contain the following informations. Okay, so the ADR reporting form, just you google it, ADR reporting form in the Google, so that you download the ADR reporting form. So in examination you may write the ADR form structure. Okay, right. So what it contains? Okay, ADR reporting form, what it contains? So first, it contain patient information. So patient initials, what age, date of birth, okay, so sex or maybe weight, so demographic details of the patient. So first is patient information. So second is, okay, so what is the suspected ADR? Okay, so what is the suspected ADR? So date of initiation, date of scene, okay, date of reaction started, okay, when it is started. Okay, so next, or when it's when you observed, okay, date of recovery, so you are recovered or not, when you recovered, okay, from the adverse drug reactions. Okay, suppose it will cause some skin rashes, okay, from skin rashes when you recovered. Okay, so that is date of recovery. Next, describe the reactions. Okay, how is going to be characteristic of the reaction? Maybe headache, so maybe skin rashes, skin redness, maybe vomiting, so maybe chills, maybe body pains, maybe difficulty in breathing. So you have to describe the ADR characteristics. Okay, next is you note down the suspected medications. Okay, generally majority of the patients need not be take a single medication, maybe they take multiple medication at a time, okay, for multiple disorders. In such cases you may note down the what are the expected drug which causes the ADR. Okay, so you have to you mention the detailed information about the suspected medications. Okay, maybe their medication names, okay, brand names, generic name, who are manufactured, batch, expiry date, dose used. Okay, at what dose you may get, at what dose you get the suspected ADR, and frequency of usage, maybe single time or 2 times a day, 3 times a day. So dates of therapy started and date of therapy started. So indication use must be provided by the reporter. So what is the indication, for which indication you are going to you are going to be use that particular product. Okay, maybe for the diabetes, maybe hypertension, you may is right. So that is suspected medication details. Okay, so in that, okay, you may write down the you may reporter. Okay, so who are going to be fill this ADR form? Reporter. The reporter may be patient itself, maybe the reporter may be assistant person to the patient, maybe doctor, maybe nurse, maybe pharmacist, anybody. Okay, who nothing but reporter. So reporter has to fill the AD reporting form. Okay, relating to all the details. Okay, next, de-challenging details. De-challenging details means, de-challenge is nothing but, if suppose if ADR is comes immediately, some person may stop the medication, or some knowingly they stop. Okay, sometimes they stop. Okay, or sometimes may continue the medication. So that you have to note down de-challenge details. De-challenge means whether you stop the medication or not. Okay, reporter must report the status of de-challenge. Okay, suppose if the de-challenge happen, and means yes, and means whenever if ADR is resulting, you may stop the medications, okay, or maybe your itself you may stop, or may doctor may stop the medication, you write down, okay. D challenge is nothing but if it is a medication stop means yes, okay. If the reaction is reduced after D challenges, okay, if yes, okay. After D challenges, suppose for example after stopping of medication, okay, if the reaction severity, if the reaction is reduced, you may write down as a S, okay. Even if the reaction even if the D challenge have still after even after D challenge, if the severity of the disease or ADR is not reduced, you may write down no. Unknown, if information on D challenge is not, for example, so I am filling the ADR report form, so I don't know so whether the person is de-challenged or not, whether the drug is stopped or not, okay. In such case you may write unknown. If information on de-challenge is not known, you write down the unknown, okay. If it is not applicable, okay, sometimes you may not de-challenging is not always is applicable, okay. So for example, those who are suffering from anaphylaxis, okay, life threatening events, okay, anesthetic drug, okay, so in such cases this de-challenging is not possible, okay. So you write down not applicable. Next, reduce dose, if dose at which the reaction is occurred is noted down, reduce, okay. If dose at which the reaction occurred is reduced, if possible, okay, you note down the reduced dose, at what doses, the severity of the disease is reduced, you write down the reduced dose also, okay. Next, re-challenge details. Re-challenge means a reporter must report the status of the re-challenge, okay, status of the re-challenge, okay. What it mean? Rechallenge means, for example, the reaction ADR is occur, okay. So you may stop the drug treatment, okay. In order to confirm the reaction mainly resulting from the drug, so how to know? Again, you need to take the medication. So if you second time, if it's immediate after second time, if the drug reaction is come, so you may confirm, not exactly, you may confirm that the reaction mainly resulting from, that is nothing re-challenge. A reporter must report the status of the re-challenge. Generally re-challenge is done, it is a process happen, okay, in the presence or maybe with the suggestion of the physician, okay. Generally it is normal persons or layman people know about the knowledge about the real challenge status, okay. A doctor will know about re-challenge details, okay. The doctor will ask you to take second time, okay, in order to confirm, okay. So if re-challenge means if you stop the medication again, if you take, okay, if the reaction is occur, okay, if the reaction is reappeared, so you write down the yes, okay. After re-challenge, if the reaction is not happen, okay, if the reaction is not happen, so this is nothing but you write down the re-challenge, okay. Unknown, okay. So right, so unknown means if the information on re-challenge is not confirmed, not at to the reporter, you write down the unknown, okay. Not applicable, so re-challenge is not applicable for injection. For example, if the particular injection causes severe anaphylactic reaction, okay, the doctor not ask to patient to take again, okay, the same drug, because it will produce a lethal effect, it may cause some death also, it is not a lethal. In such cases the re-challenge is not applicable, okay. So you write down the not applicable. Reintroduced dose, okay, if the drug is reintroduced, is it reduced dose or it is the same dose at which adverse event occurred, okay. Suppose if you reintroduce the dose, okay, you may mention the whether you use the same dose or maybe reduce the dose, okay. So what about the event status when you use a reduced dose or maybe you use the same dose, okay, that is also you have to read. Next, concomitant medication, okay. Reporter may also include all the details of the concomitant medications, that may be either other allopathic medication, maybe other ayurvedic medication, homeopathic medication and OTC medication, so when they started, when they stopped, okay. Relevant laboratory test, okay. Sometime you may do some laboratory test for for investigation of the ADR. So, for example, lipid profiles, or maybe blood counts, or maybe blood glucose count. Okay, so these are the some renal function test or kidney function test. Okay, relevant to the so laboratory test results you may include it in the reporting form. So, other relevant history. Okay, suppose report must mention any relevant history pertaining to the patient. Maybe the person having already a pre-existing medical condition like renal failure, or liver failure, smoking, alcohol use, pregnancy, allergy, or so on. Okay, so next, seriousness of the reaction also you have to note down in the ADR form. Okay, so what is the nature of the serious, okay, associated with medical event. Okay, maybe death, okay, or maybe life threatening. Life threatening means it will cause some it will cause more serious effect in the patient, but not death. Okay, it will cause something more serious, life threatening. Next, hospitalization. Okay, suppose after ADR maybe the person is hospitalized, or maybe if the person is continued their hospital stay. Okay, for example, today some person is going to be discharged from the hospital. Okay, so at the date of discharge also use some medications. Because of the medication, again used to stay in the hospital because of the nature of the area. Okay, life threatening, hospitalization, disability. If suppose any drug it causes disability in the person, you may also note down the disability status. Congenital abnormalities. Okay, so for example, what are the required interventions used to prevent or manage the ADR? Suppose some ADR is cause some anaphylactic reactions. Anaphylactic, in such case, you immediately require medications. Okay, so use corticosteroids, you may use bronchodilators. So what are the interventions you take? Okay, so for managing of the ADR. Okay, so these are you may note down in the so ADR form. Okay, next, outcome. So outcome is, so reporter must tick the outcome of the event. Okay, after occurrence, maybe immediately after occurrence, maybe after treatment. So what is the outcome? Fatal, if the patient die. Okay, you may write down the fatal. Continuing, still the patient is suffering from particular event at the time of reporting. Okay, recurring, so if the patient is recovering, if the patient is recovering from existing event, you may call recovery. Recovered, okay, if the patient is has recovered from the ADR, so you note down the recovered. Unknown means you may know unknown. Okay, so who was the reporter? Okay, so reported details, here you have to note down the reported details. Okay, name, professional address, causality assessment, whether the reporter did or not. Causality assessment, so means if the ADR mainly resulting from the drug or not. If the person is did causality assessment, you may note down the causality assessment procedure in detail. Okay, date of report. Okay, when you are report the ADR. Okay, next, who can report? Who are the persons who can report the ADR to the health authorities? Maybe healthcare professionals like clinicians, dentists, pharmacists, nurse. Okay, so non-healthcare professionals including consumers can report the ADR. Okay, so next, what to report? Okay, so what are the things you have to report in the ADR form? Okay, you can report known ADR, unknown ADR. Okay, you may report the serious ADR, non-serious ADR. Okay, you may report the frequent or rare, and regardless of the established causal relation, whatever the thing. Okay, whatever the thing, events will occur during the treatment, you can report this. That is frequent and rare. Okay, so these are the things you report in the ADR. Okay, so next, how and whom to report? Okay, so use the suspected ADR reporting form, suspected ADR adverse reaction reporting form. Okay, so you have to use suspected adverse drug reaction reporting form in order to report the ADR. So this ADR form, it is available in the IPC website and CDSSO. Okay, form, then you have to fill it and report to the any ADR reporting centers. ADR reporting, so are nothing but ADR monitoring center, AMC reporting centers. So this is about reporting method. Okay, so reporting method. So this is you just now completed about different types of ADR, so reporting methods. Okay.